Hello, I'm Dr. Ronald Brenner, Chairman of Behavioral Health for Catholic Health. We hear the term dementia often, but what does it really mean? Let's take a few minutes to give some focus to it. First, it's important to know that there are several different kinds of dementia. Alzheimer's disease is only one type, although it takes the big pie in this disease. There is vascular dementia, often referred to as post-stroke dementia. There is frontal temporal dementia. This is a more rare brain disorder that affects the frontal and temporal lobes, which will affect language, behavior, emotion, and eating patterns, among other things. Then there is Lewy body dementia, a progressive brain disease that causes problems with thinking, mainly movement, behavior, and mood. Alzheimer's disease makes up approximately 70% of all dementia cases. It causes the gradual decline of cognitive functions, including memory, judgment, comprehension, and behavior. It will likely affect 13 million Americans by the year 2050, who are going to be 85 years or older. If you or someone close to you appears to be exhibiting signs of dementia, Catholic Health has the care you need. Please call 833-NY-LI-DOC. Again, 833-NY-LI-DOC to locate a behavioral medicine specialist near you.